Okay, so to first take temperature, we're going to start with oral temperature. So you're going to, for all of these, before doing it, you would complete hand hygiene, enter the room, introduce yourself, identify your patient using two identifiers, and double check the doctor's orders. You're going to make sure that you explain to the patient what you're going to be doing and how you're going to be taking the temperature. If you're going to be taking an oral temperature, you're going to make sure that you use the blue tip probe. So you'll attach it and ask the patient to open their mouth. You'll hold it under their tongue and ask them to close their mouth until it beeps. You will then remove it, read the recording, tell the patient their temperature, and dispose of the tip. For an anal temperature, you're going to go ahead and use the red tip, and you'll apply that, and you'll put on gloves, and you'll help the patient into the appropriate position, and you'll uncover their bottom and make sure that the other parts of their body are covered and that they're comfortable. Using your non-dominant hand, you'll make sure to spread the buttocks, and you'll get the correct tip, which is the red tip, on the probe, and you'll apply a little bit of lubricant to the tip. And then you're going to go ahead and let the patient know when you're going to be inserting the probe, using your non-dominant hand to separate the buttocks. Then you will insert the probe in about 1 inch to 1.5 inches, and you'll hold it in place, and it needs to be going in the direction towards the umbilicus. You'll hold it in there until the reading is complete, and you'll hear an audible beep. You'll pull it out, read the temperature, and tell the patient their temperature. You can use some tissues or toilet paper to wipe any excess lubricant from the patient's buttocks, and then help them back into the appropriate position, dispose of everything that was used, including your gloves, and perform hand hygiene. The next one, so the axillary temperature, you're going to use an oral probe, but you're going to put a cover over it, and you'll help the patient onto the appropriate position. You'll help them to lift their arm up and place it under their arm, and ask that they fold their arm under so you can get it snug in there. And you'll wait for the audible sound that lets you know that it's done. You'll remove it, read the temperature, tell the patient their temperature, and remove the tip and get rid of any necessary supplies that were used. For the tympanic temperature, you will remove the patient's hearing aid if they have one. You'll help the patient get into a comfortable position, and you will get your thermostat, and you will put the cover over it, the disposable speculum cover. You'll place that, and you'll pull back the pinna of the ear so you can get it in the correct area. And so you'll get the thermostat in there, and then depending on the the manufacturer of the specific type of thermostat you're using, it might require you to move or hold, but you'll get it in there until you hear the audible sound that lets you know that it's completed. And you'll remove it, read the temperature on it, tell the patient their temp, and remove the speculum cover and any other supplies that were used. For the, and then you'll put a new one on so it's ready for the next one. The next one, which is the temporal artery scan temperature, you'll go ahead and get your thermostat from its charger and put a cover on, and you will trace it across the patient's forehead and back to their ear, and hold it all the while you're holding the button while you're doing it. Once it beeps, you'll read the temperature and let your patient know. And for all of these, you need to make sure that you're assessing for anything that may affect your patient's temperature. So you'll dispose of all your supplies after these, perform hand hygiene, document, before you document, you'll make sure your patient has everything that they need, that the call light is within reach, and all the side rails are up, and then you'll document.